A deeply concerning situation has unfolded within the inner-city hospital system, where individuals experiencing acute psychotic episodes have endured agonizing waits, sometimes spanning several days, in overburdened emergency departments. One such case, highlighted by a confidential source, involves a psychiatric patient in a major Sydney hospital who suffered through more than 5 days of hallucinations while awaiting admission. This unacceptable delay occurred amidst a protracted and highly publicized industrial dispute between the New South Wales government and the state's psychiatrists. The conflict, characterized by threats of mass resignations from psychiatrists, has created a perfect storm of inadequate care and escalating wait times for vulnerable patients. This industrial action has demonstrably impacted the capacity of emergency departments to provide timely and effective care for individuals experiencing mental health crises. The prolonged waits, while seemingly reflective of a systemic failure, are not necessarily indicative of delays in assessment or treatment initiation. The hospital administration insists that patients, while residing in the emergency department, undergo a comprehensive assessment, a meticulous triage process, and the commencement of appropriate treatment. However, the sheer length of stay exceeding 5 days in the case cited raises serious questions about the adequacy of resources and the overall functionality of the system. The patient's experience represents a significant failure to provide the timely and appropriate care that individuals experiencing acute psychotic episodes desperately require. Such protracted delays can significantly worsen the patient's condition, potentially leading to further distress, increased risk of self-harm, and the exacerbation of pre-existing symptoms. The lack of timely intervention can have profound and long-lasting consequences on the individual's mental health and overall well-being. The ongoing dispute between the government and psychiatrists further compounds the issue, creating a climate of uncertainty and anxiety within the healthcare system. The threat of mass resignations significantly diminishes the available expertise and capacity to handle the growing influx of patients requiring psychiatric care. The government's failure to address the core issues underlying this dispute contributes directly to the crisis in access to care, leaving vulnerable individuals trapped in a cycle of prolonged waiting and inadequate support. The situation demands urgent attention and immediate action to resolve the industrial dispute and address the underlying systemic deficiencies that allow such egregious delays in care to persist. The human cost of inaction is far too high, and the urgent need for comprehensive reforms is undeniable. Failure to adequately address this systemic crisis will not only exacerbate the suffering of those requiring mental health care, but also undermine public trust in the healthcare system as a whole. Immediate and substantial investment in mental health resources, coupled with the resolution of the ongoing industrial dispute, is crucial to prevent further suffering and ensure that all citizens have access to timely and appropriate care.